All right, so just a quick overview of the agenda for today. So we got to do welcome and introductions. We're going to talk about the goals of the What Works series, so why we did this year-long effort to develop these 4 toolkits. We're going to talk about the approach we took, share out some of our key findings. We'll give you a preview of the toolkits so you can see what they look like and also show you how to find them. They're now publicly available, ready to be used and shared. We'll have time for a Q&A. So if you have any questions as we're talking for now, you can use the Q&A feature in the toolbar. I think it's either wherever it is on Zoom on your screen. Sometimes it's the bottom. And just add your questions in there. We will get to as many as we can in the time. And we'll also share out my email address. So if there's any questions we don't get to, you can reach out and happy to answer those questions. And then we'll have some time for breakout room discussion so that you'll have a chance to talk with others if you're a CHW with other CHWs, and if you're an ally with other allies about what we will have talked about earlier, as well as how you might use the toolkits in your work to advance the workforce and support CHW-led innovation. All right, Chief Mitchum, are you able to see these if you want to take a couple?
Sure. Again, I'm sorry. I'm on my phone. Didn't expect this to be the situation, but the 4 communities of focus that we focused on for this toolkit, communities and populations were identified, which included the Native American Alaskan Natives, people in re-entry, Native Hawaiians and Pacific Islanders, and people experiencing homelessness. Subject matter experts were mostly community health workers guiding the activities for each toolkit. I'm just going to read this off. The What Works series emerged out of years of learning and hearing from the community health workers and allies about a clear need for this knowledge and resource from the CHWs, and I'll also add CHRs, because in the Native circle, CHRs, about what works, that is not working and what is needed. So we explored what works in CHW approaches overall and focused on community health worker innovation. We also focused on how partners can best support community health worker-led approaches and innovations, and we worked on identifying and highlighting innovative CHW-led efforts. Our approach included as many community health worker voices as possible. We launched a 4-step national outreach effort. One was environmental scan, web search scan. We also did a national survey. There were several different surveys put out under each topic. I do remember that for the Native American, American Indian, Alaskan Native, we also included a raffle of some beaded hats. We also did listening sessions, as well as CHW case example interviews.
Thank you so much, Chief Mitchum. And I hope it's okay to say that the beaded hats were made by Chief Mitchum. They were beautiful and incredible, and we are so grateful to be able to share those with CHWs who participated in this work. So we mentioned the survey, which was the main way that we sought to learn from CHWs about what CHWs are doing. And so we had almost 300 CHWs that responded to the survey. You can see the table on the right-hand side of the screen shows you for each topic how many CHWs responded to the survey on that topic, saying that they serve the community. We had respondents from 46 states and territories, so almost all states, and from 36 different Native American tribes and nations. I'm going to go over some of our key learnings. There is a lot more in the toolkits themselves, but wanted to give you a taste and some things you can walk away with today. So although we sought to explore these 4 different topics of 4 different communities and populations, there were some themes that showed up across all of them. And so we wanted to spend some time focusing on those today. These are likely not surprising to you if you are a CHW, a CHR promotora, or a peer, or if you've worked with CHWs for a long time. But we were able to learn a lot more about what works in terms of these factors. So you can see on the screen the key aspects of what works that were related to building and maintaining trust. We know that building and maintaining trust is core to CHW work, but we often sort of leave it there and don't kind of dig a little deeper. And so our participants shared a ton of information about what works for them in building trust. So some key highlights include consistency and follow-up, being trauma-informed, being relentless, building caring relationships, being culturally rooted or culturally aligned, and being values-led. So I'm just going to dig into some of those and give you a little more background. Trust was something that showed up in a couple ways. So we know CHWs are deeply trusted within the communities served. And at the same time, we also know that building trust can take time, require patience, and often must be earned and maintained. And this is something that showed up also in terms of what CHW said they needed from partners and employers around having that time and space to do this work that's often not reimbursed. It's often not the most quantifiable or something you could put numbers to, but is often the most important element that came up in this work as far as thinking about what works. Again, the consistency and reliability, doing what I say I'm going to do, following through on what I say I'm going to do. Caring relationships, a lot of things you would expect around spending time with people, kindness, empathy, treating people with care. Also being a safe person and someone who believes in the people that you're serving, because sometimes the CHW is the only person that might be in that role, and is hard to overstate how important that is. The values-led is talking about really the way in which the client and community is the priority. Some folks talked about some of the challenges when the requirements of an employer or another system can make that difficult, but that for CHWs who responded to the survey, that was really a guiding like North Star of the work. So these are just some quotes that are really reflective of some of these themes. There were so many good quotes. And would love for any of our SMEs that want to read any over, feel free to jump in. I'm going to just read the one on the right because it is a little longer, and the others are easier to just read on the screen. So this person said that the ability to adapt and overcome is an essential skill. I often go to a client's home with a plan to cover X, Y, and Z, and end up changing my priorities to address their priorities first and foremost. This helps to establish trust and consistency in an unpredictable world of being unhoused. Knowing that our team will be at the soup kitchen every Wednesday is something our community can count on. I am proud to be a CHW. With the appropriate training, funds, and staff, we can help patients and clients immensely.
So I'll read. I'm sorry. Creating and becoming a safe space for clients. Meet people where they are with humility, respect, and curiosity. And I am, I served. I am an immigrant. And I can understand the people I serve because once I felt and I needed the support they needed. And I participate in community events and make sure potential clients see me out and about with a caring heart, modeling compassion, inclusivity, and creating a sense of belonging works well.
Thank you so much, Catherine. And I think Catherine's going to take the next one too, talking about
Yeah,
relentlessness.
I am. So relentlessness, hey, forgive me, relentlessness was a key component of what works described by CHWs. This was described as doing what it takes to help, not giving up on people, advocating to uh, get resources directly directed to the community, and as an example, accompanying clients to emergency services, making sure clients feel safe, receive care, get seen, and receive at least adequate care.
Thank you so much, Catherine. So this really is about this going the extra mile, which, to be honest, almost every CHW that responded to the survey or attending the listening session talked about, whether they use those words or not. The example included here was discussed specifically around serving folks who are homeless or unhoused. The way in which CHWs that were talking about this described sitting in an emergency room, sometimes for a whole day, just to make sure that the client gets seen, because of how often, especially for people who are unhoused or in other situations where they experience marginalization from systems, they might not get seen at all, or get even the bare minimum of care. So in this way, it really is life-saving work, even though it might not be obvious at the front. But there were so many stories like that of the way CHWs went above and beyond and never gave up on people. It could be something as sort of intense as that example, or something that might not be quite as obvious, but was really, really profound in the responses that we received. So the other key theme that we wanted to touch on today is the importance of cultural alignment or being culturally rooted. So CHWs, and of course, when we're talking about CHWs, we're also talking about CHRs, promotoras, and the many, many other titles that CHWs hold. So CHWs really emphasize the importance of being culturally rooted. Some examples included following clients' cultural norms. This can, of course, take many, many forms. Drawing on cultural values and practices, attending community events and cultural fairs, which one of the quotes that Catherine read talked about, providing that cultural mediation. So a lot of folks talked about needing to educate and basically teach providers about clients' cultures in order to ensure that people are given appropriate and good quality care. This is especially in healthcare systems. Language access, so often speaking the same language as clients, and if that's not a possibility, ensuring translation or interpretation is available. And last but not least is building community. So bringing people together to connect with community and culture. This can take many, many different forms as well, but really building that relational fabric to bring people together in community was very important as well. So while we focus broadly on what works in CHW approaches, we also did focus in on this idea of innovation. And there's a lot more in the toolkits about this, but I just wanted to give some quick highlights. So when we talk about innovation in public health, we're talking about it differently than someone might in science or tech. We're really thinking about improving the health of communities. And this often means going against or pushing against the status quo that might not be working. So often in a status quo that prioritizes checking boxes, quick visits, efficiency, it can even involve returning to older practices or traditions. So it doesn't have to be brand new, but it reflects an improved way of doing things that's moving us toward the world that we want to live in, that CHWs are working to build. We found that CHWs are uniquely positioned to drive innovation because of the deep knowledge of community needs and lived experience, as well as having the provider perspective that CHWs bring. We also found what we suspected but didn't have evidence of broadly, which is that CHWs are innovating every single day. Things that might not be called innovation again, but are finding a need and addressing that need, and sometimes without any acknowledgement or recognition, often without resources, often on their own time outside of paid work. But the flip side is that's often not sustainable, and many CHWs lack the resources needed to innovate and lead in these ways. So while that is a challenge, the potential is immense and very promising. We also asked CHWs about what partners have done that works, because we know that the support of partners is critical for making sure that the resources and everything needed is there. And so some of the key themes that came up are here. They're also in the toolkit. There's a section really focused on this called What Works for Partners, which we'll get into later. If you are an ally, this is a great section to check out. CHWs said that ways in which partners have helped them to better innovate and lead include providing flexible, equitable, and sustainable funding. This was by far and away the most common theme that came up. Flexible funding meaning allowing for things like modified deliverables if things change, because needs are constantly changing and situations are changing, and that need to adapt and pivot was really important. Equitable funding was largely around making sure that small organizations, not even organizations, but grassroots efforts, CHW leaders who see a need also are able to access funding without having a large nonprofit infrastructure, at least at the very start. And sustainable funding, I think this is probably obvious, but startup funding is essential, but also to continue that is also essential. Other things partners have done that CHWs found really helpful included helping make connections to other folks who can support in these ways, like policymakers, funders, or others. Providing resources and services to the community beyond what they might already be doing help CHWs to feel that there were more resources available for clients. And that could really help as well when there's so many needs often. And then last but not least is recognizing the work of CHWs. Many states have formalized policies, many don't, but just having that recognition was really, really important. I apologize for the delay, just having a small technical glitch. All right, I think we're all set. So now I'm going to do a quick preview of the toolkits themselves. So they're just some photos of what they look like so that you can get a feel for what they look like. And when you check them out, you'll have a sense of maybe the sections you want to read and things like that. But it's more focused on what they look like than the content right now. Each toolkit is organized into several sections. The background really provides that context of why it's so important to address health needs within each community, what some of the challenges are. Also, if there was something related to policy or an ongoing current event, things like that, there's also background on that. So it's really that context and can be a helpful resource for a lot of different uses. Each toolkit then has a section on what is CHW-led innovation, which just goes into more depth on what we were already talking about. The findings, again, more depth in what we've been talking about. The case examples I'll talk about in a minute, but those are a huge highlight of the toolkits and really, really incredible. Each toolkit has a CHW innovation worksheet. This is meant for CHWs to use, and we will look at that in a minute as well. And then a section on resources and references. So the toolkits are free, they're publicly available, they're on our website. We'll put the link in the chat, but we really, really encourage you to check them out and use them as you see fit. So again, each toolkit has a background section. This is where you can read about the topic, the community, the population, health needs, assets, barriers, and any related policy. The CHW-led innovation really talks about CHW-led innovation, why it's important, what it is, and the ways in which CHWs are leading and innovating. The what works section is really the core part of the toolkits that reports out our findings. So talking about what works is a really broad question. So we tried to organize it into these 3 different areas of focus. So program focus, which includes developing new programs and improving programs that already exist, policy and system changes, and then addressing individual health and social needs. And as you can see, we really wanted to emphasize that each of these are rooted in community and stem from work CHWs are doing in community. The case examples are they're great. I highly recommend checking them out when you have time. They are examples of CHW-led efforts and innovations. We identify case examples through many ways, through the environmental scan that Chief Mitchell mentioned, as well as through the survey. There were many, many more examples of innovations than we could include in the toolkit. So especially if you're someone that shared a story and it's not in here, that doesn't mean it wasn't incredible work. There were so many more that we can include, but we really tried to select those that highlighted some of the key themes that we were hearing about. So across each toolkit, you can read about CHW-led efforts to serve the health needs of communities that each toolkit is about. There are stories, so they're engaging. They talk about some of the challenges faced, challenges going forward, how they address those challenges, and some examples of the impact as well. And I know we have several folks who are actually featured as case examples on the call. So if any of you would like to say a quick hello, I think we have Ms. Mavis. I think Wanda's here. Would love to just have a quick hello. You could mention your organization or your program that's highlighted if you'd like.
Could go. Can you hear me?
Yes.
Okay. So my name is Mavis Boone. I am with the Pacific Community of Alaska, here in Anchorage, Alaska. We serve marginalized communities, primarily the Native Hawaiian Pacific Islander community residents in the state of Alaska. I believe part of the toolkit was with our CHW, our health and wellness program, which is facilitated by our community health worker program. So that all
Thank you so much.
needed to say?
That's great. Yeah, thank you. Just so folks could put a face to your name, I really appreciate it. Anyone else? No pressure, but would love to hear from you.
So I'm Wanda Price. I'm from Des Moines, Iowa, and the portion of the toolkit that I participated in was the advocating for change for reentry, a reentry program that I was volunteering with was not including the trauma-informed care and other pieces that are very vital for somebody to make change and have a wellness of health. And so I am still advocating for additional services in that arena to improve the services that the reentry program is providing to the community.
Thank you both so much. Really great to have you here. Appreciate it. Was there someone else? I can't see everyone, so I apologize if I miss anyone, but I think that is it.
The toolkit I worked on with the great
Hey, Felicia, it's a little, I don't know if it's on my end, but the audio is a little choppy. But if you would like to, if you have a better connection, please jump in again.
Okay, my name is Felicia Cunningham, Topeka, Kansas, certified CHW, and a part that I did on the toolkit had to do with integrating CHWs into hospitals and how that could be effective to better assist clients or patients with more than their medical care. Social determinants of health out of that.
Thank you so much. That's, I could hear you much better. Thank you. All right, so I'm going to jump to the next section. So this is in each toolkit, which is the section I mentioned a little while ago, which is really meant for allies, so partners, funders, policymakers, employers, and any other allies, researchers as well. There were two core aspects of what we pulled out in terms of this section. So what works for partners in terms of supporting, amplifying, and strengthening what works in CHW approaches, and then partnering with CHWs to advance CHW-led innovation. We don't have time to get into everything in the section, but highly encourage any allies on the call to check it out. They're on the website, and we'll share that link again. This is, I think it might be a little too small to read for folks, but this is the CHW Innovation Worksheet. It is in each of the toolkits. This is meant to be a resource and a tool for CHWs. You can download it as many times as you want and use it as a place to draft ideas and brainstorm. It's really meant to guide you through the process of thinking about innovating in any way. So it could be as focused as making an improvement, like Wanda talked about, within a program that you work in and trying to improve things and make things better. It could be starting a whole new organization or program. It's really just a space for you to use and a tool to work with. And the worksheet was really pulled on our learnings from this project. So we hope that it is useful and that it can be helpful in thinking about this. Of course, each toolkit has resources, so they all have hyperlinks so you can click and learn more. There's so many good resources out there, so we just wanted to pull some that we thought might be most useful, both for CHWs and for allies. And then, of course, the references, another place to find some useful resources as well. So we have some time now for Q&A. Would love to hear your questions, and I'm going to stop sharing my screen. So any questions, if you have them, you can put them in through the Q&A button at the bottom of the screen. I see the first question is about the slides. We absolutely will share the slides out. And I believe we'll also have a recording that we'll be able to share as well. So we have about 10, 15 minutes. So fire away with any questions. You can ask questions for me, any of our SMEs that feel up to the challenge of answering questions. And I think if we want to do questions using the audio, that is fine as well. So Anne, do you want to jump in?
I don't really have a question, but I do have a comment. I really appreciate the fact that the amount of time that CHWs spend doing their work, because we're initially building that relationship and regarding that trust of the individuals we're working with. I'm really happy that that's included, because I personally have felt this pressure cooker, if you will, to speed up my work and to touch more people each day. And if you're touching them and it's not quality, you're really not getting to their needs. And you're certainly not addressing the core or the heart of their situation. You're only responding to what might have been addressed in a referral. And oftentimes that's not even the problem. So I feel like we know how to do what we need to do. We just need that support from our funders and our supervisors to allow us that grace to treat people the way they need to be treated, and certainly the way we want to treat them. So I appreciate that, hearing and seeing that in this toolkit.
Thank you so much for lifting that up, and you're getting a lot of hearts and claps and agreement in the chat. I wanted to add that, you know, one of our hopes is that this toolkit is a resource for you. So when you're in those situations, being able to have a resource that you can show if it's appropriate and safe to show an employer or a partner that, like, look, this is something that we need to do, that we need time to do, because this is central to doing our work well. So our hope is that this is a resource that you can use and really in whatever way you need. Maybe put it in the chat or the Q&A too, and then we can try to, I'll voice it over if that's easier. So I'm just looking at the chat. So I see CHW hiring, what makes us worth being at a health facility. Rita, do you want to share more about the question or what you're thinking?
Yes, a lot of times when we go in to provide services and we're there, we see a lot of things that are going on and happening that we could improve on. And they look at us, oh, they're just a CHW. But they don't realize that we could change their whole, I want to say, for the lack of a better word, life, but how we can better help them to provide resources and help their health client. Is anybody else seeing that, and how are you tackling that?
Absolutely. Thank you.
Hi, Rita. This is Areta Tupola. I'm at the Utah Community Health Worker Association, and we have been working on that for a while since COVID, because a lot of our CHWs were being or needed in the health facility and the health systems arena. We didn't have much before, but in Hawaii we did, which is where I come from. And one of the things that we have been doing is really drilling in the consulting around the value of CHWs and working on the SDOH pieces and other areas that the providers don't have time for in the exam room. And what we've done was worked with a lot of their administrative staff in implementing and integrating CHWs as a part of workflows, as a part of provider care teams, that they're valued the same as a provider, because the information that we bring should be just as much value. It brings so much more impact, I think, in our creating care plans for patients. And that has been working. I mean, it took us a while, but now that they're implementing, the health systems are listening more and seeing the impact of that work. And now CHWs are part of every care team conversation.
Thank you so much for sharing, Areta. Incredible advocacy work. And I see some folks in the chat sharing, having the same struggle. So I see a couple other hands up, Tiffany and Felicia.
I just wanted to go back to I just wanted to mention when she spoke about time in a previous comment, our time being valued and considered, and compensation as far as building relationships with and trust with the clients. That same time and effort is put into also the providers as well, and who our allies would be with those random coffee talks or tea with me or whatever it is. That takes time to establish a relationship of trust as well. So therefore, our value continue to go up if we look at it as far as time all by itself. We look at the time spent to build relationships and lay that foundation. And then when we get the relationship established with that particular ally or nonprofit or provider, they can now talk us up. They can now be the allies. They can talk about, yes, this person should be contacted and this person should be a part of the actual workflow.
Thank you so much. You're getting a lot of emoji reacts and agreement as well. We just have a minute for one or two more questions. I know, Tiffany, you had your hand up, and then I see Kelly as well, and then we will jump to some breakout rooms.
Yes, good afternoon. I think a part of being accepted well into a health system is CHWs being confident. I became a CHW in 2012. I think when you know your job description, when you know what you're capable of doing and how you can explain that to somebody in little to no time. So you need like an elevator speech, right? And you need to be able to stand firm in that. Not only that, but you also need to be able to know when to refer up. Don't make promises that you can't keep. If it's above you, you say, that's not something I can do, but I can give you to somebody else that can. That's really important. I started my CHW journey at St. Christopher's Hospital for Children in 2012 or 2013. And I went straight to surgery. So it was very difficult explaining what a CHW was all those many years ago. But what I did do is I had a lunch and learn one time a month. And I brought all of the social workers who were scared that I was going to take their job. We all came together for lunch and learn. And every one time a month, we sat down and we talked. And I told them exactly what I did, why their job was vital, and why I would refer to them about certain subjects that I knew that were out of my scope of practice. Once they had that confidence that I would do that for them and keep them in the loop, we were perfectly fine. But I think it's just very important for CHWs to be confident in who they are and be able to explain their scope of practice and why they are vital. When we become more confident in what we do, then it's easier for other people to accept our role, especially within healthcare.
Thank you so much. Lots of agreement in the chat as well.
I'd like to add to what she was saying, Nina, if I could,
Please.
not just the ability to the elevator speech and confidence in what your role is, because what I've seen in the CHR, CHW is that each organization or agency or hospital, whatever the situation, whatever the organization background, they utilize community health workers in different ways. So there's not like a hardcore, this is what community health workers are across the board, because it changes a little bit everywhere. But there's times when, in my experience, in the Native American, Alaskan Native circle, where I've seen subliminal cultural digs. And as you know, hang on one second, I might have to mute. Okay. As you know, during this toolkit work, my mother had a stroke. And in fact, one of the times that you and I spoke and a couple of us met, I was at the hospital. It was all fresh. And speaking towards the dig, knowing that she's Native American, when she got to the rehab, everybody else had these cute little nice holiday blankets, and my mother is laying in a bed with a wool Army issued blanket that had a U.S. stamp on it. So I thought, okay, I got your message. You can have your blanket back. Hope it didn't have smallpox. And just reiterated that, not just her daughter, but also community health worker. And this is not acceptable, period, for anybody. And standing in the gap, really, is what I see the biggest role for community health worker or CHR, standing in the gap. I personally, as a CHR, have been working outside of our circle, Pine Hill Health Network. I've been aiming at the Apache, trying to figure out how to get in to help them, because I see so much that can be done. But then here locally, I see a lot more than post-COVID than pre-COVID. That's just more blatantly obvious. And when you have somebody that just needs a ride to the doctor, you're just driving. So that's community health work to us. Also, while we've put this toolkit together, we have had amazing storms, hurricane, floods. North Carolina got hit pretty hard. South Carolina, this area flooded. And it took us back to the first base. And so when you have to keep coming back to the first base, it just reinforces you're coming back with experience, and you're re-examining the approach, and you have to be able to pivot to meet meet what is going on at the moment. So we have had to not only deal with subliminal issues, which I'm sure all across have experienced, but you also have to, as a community health worker, be able to pivot to meet the demand in the moment. So when we go from normal day to day to an emergency, of course, we don't expect everybody is capable of dealing with an emergency, but we at Pine Hill have had to switch gears a few times for emergency purposes, and I think that that's another piece of the toolkit that's important, and something that is great for the community health worker as a whole.
There is still time for me to talk, or later? Sorry.
Go ahead, Kelly.
Oh, thank you so much. So I would like to say that here in Springfield, Illinois, we have a nice amount of Hispanic population or other countries for refugees, and there is not much to offer to them as a community health worker level, because the 3 hospitals, only one has a community health workers, and is are 3, and they are not bilinguals, and they don't provide any kind of transportation. And I know the insurance help with the transportation, but this lack of providers or community health workers. We have a medical center for people with low income or no insurance, and they don't have any community health worker, and I am the only community health worker in the entire area. And it's very difficult because we need more people, and it should be something like a hospital should have at least one community health worker, and any medical center work with the federal grants, they should have a community health worker too, but they don't have any. And I am the one who go to the hospitals to accompany it, I'm sorry, my English, to the young moms to deliver their babies, not just for interpretation, but it's more for emotional support, because these young girls are, most of them, being victims of human trafficking. And so I wish there is more awareness in between the big organizations from the state to try to implement more community health workers also on the schools, because the nurses on the school is one nurse for 4 schools. And sometimes, we have kids with asthma, with other conditions, but and then the medicine is locked. And if this kid has any kind of asthma, the nurse is not at the school, it's at the other school. And I feel like there should be more, there is more opportunities for community health workers, but I don't know what is the making us stuck and stay on the limited. And thank you. I don't want to take all the time. Thank you so much.
Thank you so much, Kelly. It's definitely something you're getting a lot of agreement in the chat, and something that we also heard time and time again. I think, we heard one CHW for 8,000 people, just really, really not sustainable, not okay situations going on. We're gonna open the breakout room, so you'll get to keep chatting if you didn't get to speak yet. So I'm gonna just voice over the breakout rooms for time. So room 3 is gonna be allies. So if you said in your registration you're an ally, you'll be automatically put in room 3. If that's an error for any reason, just come back to the main room and we can move you. Room 1, we're going to do combine 2 of the toolkit topics. So for any CHW, and room 1 and 2 are CHW's rooms. So room 1 is going to be CHW serving Native Americans and Alaska Natives, as well as Native Hawaiians and Pacific Islanders. So please go over to room 1, and Retta is going to facilitate some discussion. And then room 2 is for CHW serving people who are unhoused, as well as people in reentry. So you can select the room based on which makes sense to you, and you'll have about 15 minutes to chat, and then we'll regroup and close up after that. To Michael for helping him make sure everyone got where they needed to go and got back. That is not a small task. I would love to we don't unfortunately have time to talk too much about it, but would love to just get folks like through an emoji react of how your experience was in the breakout room. So something, thumbs up or heart or anything that reflects the feeling tone that came up with. If it stressed you out, you can put an emoji that reflects that too. Whatever feels like it speaks to your experience. So I see some hearts, some thumbs up, some laughs. I hope folks got to laugh a little bit. That's awesome. Some more hearts. So our breakout room, I was in the homelessness and reentry group, and we had an incredible conversation. And it got hard at points talking about the challenges out there. And I wanted to ask Treva Smith, who's one of our board members who gave an incredible little pep talk, if you wouldn't mind just sharing what you shared with everyone here, Treva. It doesn't have to be word for word, but whatever was in your heart that you want to share.
Yeah, I'll just share a little bit. I just wanted to encourage folks. It's rough out here everywhere, right? And I wanted to just take the time to tell folks, step back if you need to step back. I know it seems like, well, this person in need, so many people in need, but we can't take care of other folks if we don't take care of ourselves. Step back, dust yourself off, and get back in the fight. We need you in this fight. Continue to support NACHW when you can, and other community health workers. Angie put some things in chat about joining the advocacy committee, right? and just getting in this fight more than ever now, we have to collaborate, we have to work together, we have to band together. But we are community health workers. We know how to survive, right? To thrive. And so that's what we're going to do. We're going to work together. We're going to survive. We're going to thrive. And if you need to step back, step back. Thank you. Thank you
you so
all for all
much.
the work you do.
Thank you so much, Treva. Really appreciate you wrapping us up with that speech and that just incredible, just like heartfelt encouragement. I just threw some links in the chat. We're going to wrap up. So the toolkits are live on our website. You can access the full document. It's a big PDF. So we also broke it out by section. If you just want to pull out like the CHW innovation worksheet or the What Works for Partners section, you can go directly to that in each of the toolkits. So they're all there. Use them. They're free. They're public. Share them. I hope we all hope they're a resource for you. I want to thank again our SMEs and NACHW staff who made this all possible, and everyone here for bringing your heart, your experience, and your expertise today. There's also a post-event survey. We'd love to hear from you about how this was for you, if there are things we could do better in the future, and just how we can keep improving our programming. Also a plug for the CHW Connector. I know a lot of folks were able to share challenges and help one another. This is a virtual space that is meant for CHWs to be able to do that 24/7. And so if you have questions or struggles or concerns or even jokes or anything, you can connect with one another. It is there for you. And Unity. So if you haven't registered for Unity and you're able to make it, please come. We would love to see you. And if you can't, we hope to connect with you virtually and in other ways. So please reach out. My email's in the chat if you have any questions. And just a big thank you. Be well, stay safe, and take care of yourselves. So thank you all.